This is Heart Rhythm TV, and I'm Ambrose Panico. I am thrilled to introduce our next guest, a man who needs no introduction, Dr. Tom Deering. Welcome to the studio. Super excited to talk about the new program here at HRS this year, the Business of EP. So I'm going to ask you if you could just give us kind of a highlight of why the Society chose to include this programming this year for our viewers.
Ambrose, thank you for the kind introduction. Yes, it's an honor to do that. You know, medicine has been changing, as you know, and over the past decade or so, we've seen, unfortunately, significant demographic changes. That mean we have more patients to take care of who are aging with more disease. And we've made great inroads, but that comes at a cost. And as you know, over half of the hospitals in the United States now actually run in the red. So that's not a sustainable future. So we've got to figure out how we go forward on that. In addition, although I think we've advanced quality, there are variations in how we do things and quality concerns. So both of those factors have led to a situation where we're advancing towards value-based care, where we improve quality at a lower cost. And we've got to figure that out. And physicians have to be key stakeholders in driving that. Now, having said that, there are, as you know, Ambrose, a whole host of different stakeholders, administrators, payers, regulators, other clinicians, etc. So we've got to figure out how to build that team, because this is a team sport. So what we thought we wanted to do is, at this particular point in time, this was our first series of sessions. We wanted to set the stage. We wanted to address the multiple options. We wanted to get different stakeholders here who look at it differently, come up with some questions, concerns, issues about where we are, and suggest some potential future solutions. We didn't solve anything with that, but we wanted to set the stage and educate physicians, because you know as well as I do, by the time you finish medical school, you train, you go into whatever it is, your practice, your academic role, you don't pay attention to these things. But if we're not involved, if we're not knowledgeable, if we can't speak the language, we're not going to be able to lead in the right direction. So that is our rationale for setting it up, Ambrose.
Perfectly stated. Couldn't agree more. If you could, for those that weren't able to come and weren't able to attend, can you just highlight some of the issues that were discussed in the sessions?
Absolutely. We basically set it up as 3 different sessions, and then we had additional components on the side. So let me quickly go through them. The first thing was to kind of define the landscape of where we are. What are the problems? What physicians need to know? Learning the language that is spoken. And it was funny because I ran into so many people afterwards who told me, I didn't even know what that term meant, that TLA. So setting the landscape, I think, was, to me, really the most important thing. The second thing that we looked at is, how you should develop, build, consider, grow, and, orient your practice. And that is independent of whether you're in an academic setting, whether you're in a private practice setting, or you're in that intermediary, institutional setting, so that you know the issues that all of the different stakeholders are looking at and what you need to be aware of and how you can impact on that. The third thing we looked at is, if we're going to really determine how we do this best for the care of the patient. And our goal with this session, Ambrose, was not to say, how do you make more money? It was to advance the care that we're already delivering to a higher level. So what we wanted to do is see what skill sets physicians need, what they need to be able to do to become leaders either in their own organization or broader in a wide-based way. And then we had additional health policy and quality improvement sessions that dived down to a little deeper level on those particular things as independent sessions. Yeah. So that was kind of our concept, if that answers your question.
Answers it perfectly. And I think that at the end of the day, as you just alluded to, this is not about how do we make more money.
It's not.
This is how do we perform high quality, low cost, efficient care. And when I say efficient, I mean how do we get our patients treated quicker and treated well?
And appropriately according to the guidelines.
Exactly.
Exactly.
100%.
Because we know that there is some concern about that, and we don't want that to drift in a bad direction.
Right.
Yeah.
And I mean, everybody's going to be really excited about this, and I know I am personally, but can you give us maybe a little bit of a look under the cover of what's to come next?
Absolutely, Ambrose. I think the interesting thing was that I was worried that there would be, 3 people sitting in the room in addition to the faculty. It was standing room only. And there were people in the aisles who couldn't in the hallways who couldn't get in. So I'm confident we're going to be able to repeat this on a newer level next year. Now, this was 101. This was the intro. So we've got to raise the bar, and we've got to address, the things in a broader, higher, deeper level. In addition to that, I think what we would also like to do is to set up regular sessions, maybe monthly, maybe every monthly. We have to decide that as a team, but basically that would be focused on individual components. And you need to know this about developing and building an ASC, or working in a joint venture with your institution, or putting a program ahead to advance quality approaches for heart failure and into AFib and how they interface. So those types of things, I think, are where we're going to be going. And I think we also want to make sure that folks understand where we are as an organization. There's a lot of confusion about, the RUC, and we do have representation there, which is, important, but we've got to make sure that we're able to continue, again, not to make more money, but to have an ability to have the funds to generate the care that patients are going to need to get the outcomes that they want, however that is distributed.
Yep. Like I said, I'm super excited for this. Hopefully we'll be able to cover some more on HRS TV throughout the year and at the next Congress as well. So look forward to what's to come. So on that note, let's go ahead and close this session out. This is Ambrose Panico with HRS TV. Don't forget to like us below and follow us on Twitter, X, and LinkedIn for more.